Epilepsy is a very common problem throughout the world. Take, for example, in Pakistan, millions of people are suffering from it, or maybe even more than that. It affects people living in rural areas as well as urban areas, men as well as women. Epilepsy is the fourth most common neurological disorder. As an estimation, 70% of people who have epilepsy are young, while 30% develop epilepsy after 50 years of age. Sometimes, a test is done to make the diagnosis of epilepsy. This test is called an EEG. During an EEG, electrodes are applied on the scalp, which records the brain's electrical activity. An EEG may show abnormalities in the brainwaves, and it is then helpful in diagnosing epilepsy or its subtype in a patient. Why do people develop epilepsy? In 70% of epileptics, there is no apparent underlying cause, but a suspected cause involves the dysfunction of neurons firing abnormal amounts of electrical impulses. These billions of neurons in the brain release electrical impulses that send messages to tell different parts of the body what to do. If a person has epilepsy, some neurons may fire too rapidly and randomly send many messages at the same time. This then overwhelms the brain and can cause seizures. Gabapentin is a common medication that is used to prevent and control seizures along with relieve nerve pain. It is an analog of GABA which functions as an inhibitory neurotransmitter responsible for pumping the brakes on our nerve impulses whenever we're placed in less than ideal situations. Glutamic acid decarboxylase catalyzes the decarboxylation of glutamic acid to form GABA. If there's a dysfunction in this process, less GABA is produced, allowing electrical signals to flow more freely. This is when gabapentin would come into action. Once gabapentin is ingested, a small amount sits in the stomach for a period of time. Eventually, a controlled amount is released from the stomach to the optimal site of absorption, the small intestines. In the small intestine, gabapentin absorption is mediated by active transport in the large, neutral amino acid transporters. When calcium enters the neuron, it binds to the vesicle to modulate neurotransmitter release. The neurotransmitters released include acetylcholine, dopamine, glutamate, and others. When they bind to their receptor on the next nerve, they transmit the electrical signal. With such neurotransmitters bound to their receptors, the electrical signal is transmitted throughout the brain. After gabapentin is absorbed, it binds to its high-affinity binding site, the voltage-dependent calcium channel subunit alpha-2 delta-1, and this results in a decrease in calcium influx. With less calcium available to bind to the vesicle, less neurotransmitters are released. This decrease in available neurotransmitters slows down the transmission of electrical signals. With the electrical signals being reduced, the conduction in the brain is stabilized. As shown in the previous example, when someone has epilepsy, there is a large influx of calcium ions. This results in the increased electrical signaling as well as depolarization of the cell. With the continuous influx of calcium ions, the cell will eventually reach its threshold or move beyond it. This is when gabapentin would bind to its high-affinity binding site, the voltage-dependent calcium channel subunit alpha-2 delta-1. With gabapentin bound to its binding site, there will be a decrease in calcium ions. Repolarization will begin to occur when the flow of positively charged ions move into the cell. Because gabapentin continues to inhibit the calcium channel and positive ions move back into the cell, the neurons begin to return to a stable state. Even though epilepsy is the fourth most common neurological disorder, it is not talked about as often as others. People with epilepsy oftentimes don't know what causes their seizures and feel embarrassed, ashamed, nervous, and worried they will be treated differently because of this disorder. This is why it is important to continue researching epilepsy and spreading the word.
My dad is my hero because he helps calm me down when I'm having seizures. If your parents try helping you, let them help you, and it'll help a lot. Talk about it!